Tell me a little bit about you first.
Well, I'm 5'7", blonde hair. I'm kidding. I'm not kidding. I am 5'7". So Christy Plaice. I've been fully licensed almost 10 years. Had associates for several years before that. But really my passion is addiction, complex trauma, and that can involve a variety of different types of trauma. Really, trauma to me is what dramatically impacts a person's well-being and livelihood and how they move through the world. How trauma gets locked in the body, gets locked into their cells, and really impacts multifaceted areas of somebody's life. And then another area of specialty that I do a lot of work in is around gender identity, whether that's transgender, gender diverse, some people say gender variant, but really what lies under the trans umbrella around gender identity. So I would say that's a big bulk of the work that I do, and I like to use a lot of different multimodal approaches. So I'll use certainly talk therapy, but I do a lot of somatic attachment and body work and looking at attachment adaptations. And that can also mean sitting on the floor, doing some floor work. That can mean utilizing art, any type of creative expression. We will do burning bowl ceremonies outside. Music can be really important. And again, just really accessing what feels healing and connecting to a client. And I want to support that work for them. Some clients may say, oh my gosh, please don't make me do any kind of artwork. Okay, then that's what fits for them. That's what fits for them. But art and different kinds of expressionistic and experiential therapies can definitely speak way beyond the language center of our brain. And I like to be really connected and aware of that.
How do you fall into those specialties?
Great question. Well, I have some family history of addiction, so I get that. I have family and loved ones that have struggled and suffered in addiction, as well as coming through the other side and having some recovery. I think a second piece is I am also a trauma survivor, a complex trauma survivor, which means that really more than one something has happened to me that has impacted my life in a traumatic way. And the good news about being a complex trauma survivor is that what pulls me to this work is I know the power of healing. And I know how that can just change your spirit and how that can also impact the world around you. So I really am in a place where I identify myself as a healer and really helping to facilitate healing for others. And then gender identity, I think we are continuing to hear a little bit more and more about that with media. And for me, it came from a personal experience of meeting someone who just was in a lot of pain and a lot of darkness and suffered severe substance use, had radical times of often suicidal ideations, and just was in a lot of pain and was really sitting on the secret that they just weren't allowed to talk about or question. And what came up for them was around their gender and feeling like they've just been trapped in this body that doesn't belong to them. And watching the experience of what that was like for them to be able to share that and instantly feel this sense of freedom just by being able to name it. And for me to have this awareness of, gosh, I sure don't know very much at all, and remember feeling thirsty because I loved and cared about this person so much that I need to get some education. I had some compassion for sure, but I need to get some education, some training. And how can I support this person? And lo and behold, more people started coming into my life. I think the universe was bringing that to me because my heart center was open to hear and learn and receive more. And so that's really where it's continued to grow. And I think in the South especially, we're really behind, I think, in terms of being on the West Coast at times. So I feel the need and the impact and the advocacy here in the South is important. I think it's important everywhere on the planet, but really wanting to be at the forefront and stay on top of that as best I can to help families and people just really have some understanding around it so it doesn't feel so scary.
So a question I think we hear a lot when it comes to gender identity, is it a choice? The thought that comes to mind is there's probably even some traumatizing that happens to the family because they're raised with beliefs about what their quote-unquote daughter or son is supposed to look like. How does that feed into traumatizing the individual as well as the family and anything that might come after that?
So those are a lot of really good questions. So the first one is it a choice? And so kind of how I like to counterbalance that is it a choice to just, do these people choose to suffer, choose to isolate to where it's painful, choose to be made fun of, choose to walk through a life where they're bullied and ostracized, live in angst, live in confusion, frustration, have families at times disown them? If they could choose that and choose for none of that to happen, sure they would. So no, it's not a choice. And if they could choose something different, I assure you that a lot of those people would, because it would be, quote, the easier path in our culture, really in the world. So it's not a choice. It's a brain component. It's not about the heart or feelings, right? And I think that's the confusion. So when we think about feelings and what we're led and drawn to emotionally, that's more around sexual orientation, right? So who we're more sexually attracted to, right? So that's more of that feeling place, right? So gender identity is really a piece that's in the brain. It's not about the feeling or the heart center, so to speak. It really is about this piece in the brain that says this body or this worldview of how I'm supposed to connect to this biological gender does not match up with how my body is now, or the gender roles that are being assigned to me don't fit me. And I assure you, many of these people have tried and even over masculinized or gone to the extreme feminine of thinking maybe I'm just not doing it enough. So I've worked with a transgender person who was biologically born female, and she thought maybe I'm not doing enough female things, which is why maybe I'm thinking too masculine. So maybe I need to up my femininity. So she became a model. She was in different beauty pageants. She got different plastic surgery to up her femininity, thinking maybe that's going to make her feel that much more connected to her femininity, and this whole masculinizing thing will go away. That was her one attempt, and that's one of many stories, which certainly wasn't the case. I've also met men who have done the same thing, biological male, who are even feeling so upset and so ashamed of the thoughts and feelings they're having to really overcompensate. They join the military. They play a really aggressive, intensive masculine sport that we identify masculine traits, and then they find out, gosh, this is awful. This isn't working. This isn't helping. So again, another part of them also doing that is to help with their family. So you ask about the family piece, and that certainly can be a conflicting time and a confusing time. So these people don't choose this for themselves. They're able to connect. Some people have what we call gender dysphoria, which is they're very connected to part of their anatomy is very uncomfortable, very intrusive of their life. They need this gone. They need this changed. And it's pervasive. It's intense. It's upsetting. It's anxiety provoking. It can bring up depressive symptoms that really can become debilitating. So again, that's something that can really be impacted. Now, all transgender people do not necessarily have gender dysphoria, but that certainly, again, is not necessarily a choice. Some people talk about, oh, well, if someone's trans, let's say if a biological female, right, all of a sudden wants to be a guy, she must have been sexually assaulted, right? She must have been abused by a male, and so now she's wanting to, identify as male and slough away her femininity because that was really abrasive and scary. And that's just not true. I think we hear stories about that, especially around sexual orientation, especially with women. Oh, she must be gay because some guy hurt her too much, right? And the reality is there are many, many women and men who are abused by the opposite gender and still romantically are interested in the opposite gender. For a transgender person, this isn't about something traumatic happening to them and then as a result they've decided that they're trans. The unfortunate part is that for a lot of these folks, they are connected to their gender identity early on, and because of connecting more and more to that and letting that come out a little bit, then some trauma starts to take place, which is really unfortunate. And we hear about things all the time from family members, either emotionally, physically abusing, harming their kids, kicking them out of their homes, being hateful, being bullies to their own children. And then, of course, we see that in school systems. We see that in public. You know, the highest murder rate in the past couple of years have been transgender women of the African American community. The murder rate is unbelievable. And the only reason they are murdered is based on their gender identity and how they're being authentic to who they are. So again, through that, trauma can begin to take place, and it's sad. And then the hope is that we get someone in, I get someone in, which has happened, and they come in and you sit with a parent who says, I love my kid and I need to figure this out because I'm confused, I feel sad, I feel angry, they're not happy, and I don't know what to do. That is such a gift for that kid and for this family. So that's a big piece of it.
You usually see that the family of a transgender person needs to seek some sort of professional help as well too?
Not always, but I think that's a great question. And if they've never really done this journey before, and most have not, right, there's a lot that they don't know. Now, certainly in the age of being on the internet, there are a lot of things people can look up about a lot of stuff, and some of it's great and some of it's not. But to me, seeking out that professional support is, I do really believe in the work of doing family therapy around that. Because what I'll tell this mom, for example, about her kid is, while your kid is wanting to transition, it's really a transition for the entire family. Kind of like we talk about addiction, right, or substance abuse, it's a family disease. We talk about that all the time, and addiction impacts the family. So, of course, right now we're talking about gender identity, but the same philosophy is true. The transition impacts the family system. So I would want to meet with mom, dad, grandma, Aunt Sally, siblings, whoever that is, really to have this open dialogue and process around their questions, their frustrations, their confusion, their happiness. Sometimes people say as soon as they came out about this, everything made sense. The dots started to connect, like this made sense. For some families. For some, they're just really in this place of fear. And a lot of my families go to a place of, I do want them to be happy, and I'm really scared to death for them. So really walking through what it means to have safety, what it means to have education, and through that can help some of that fear. And families go through a lot of grief and loss. You know, if you have a teenage girl born biologically female, and this teenager tells parents, you know, I really don't, this doesn't match me, this isn't who I am. Gosh, these parents go through a myriad of feelings and emotions, and a big part of that is now they're connecting to this awareness of, I feel like I'm losing my daughter. She's gonna go away because now she is wanting me to call her a male name with male pronouns. And all of these thoughts and dreams and ideas that these parents had for this girl now are really different. And so they're going through a sense of loss. And oftentimes for a teenager, they don't really get that because they'll just say, I'm not dead. I'm not dying. I'm still right here. So also giving the teenager or adult some education around that to say, you've been dealing this with for a while, but mom, dad, grandma, Aunt Sally, parents, whomever, this is really new for them. So really supporting everybody on that spectrum of what it means to come together and everybody have their process. So do I think parents need that extra support? Yes. Regardless of their history, regardless of what's going on, this is new, and education is really, and their feelings are really important to help them navigate through that.
Did I hear you correctly earlier when you said there's a difference between gender identity and sexual orientation? What's the difference between, dealing with a transgender person that's suffering from substance abuse and dealing with something with sexual orientation and substance abuse, or is there one?
Yeah, that's a great question. Well, to me, they're all people, for starters, for sure. To me, I look at substance abuse as not so much what's wrong with you, but what's happened to you. That's the question I want to sit with clients about, is what's happened and what's been going on, and where's the pain? Where's the pain? You're using is filling this need somewhere. Sexual orientation and gender identity have nothing to do with the other, essentially. And I believe that's where our culture can get really confused, because it's confusing, because there are all these different letters. I call it alphabet soup, so to speak, right? All these different letters, which can feel really confusing. So again, sexual orientation, if we look at that, sexual orientation is about who you are, or who a person is romantically and or sexually drawn to for the purpose of romance, dating, sexual interactions. It's who their heart center says, wow, this person's attractive, or wow, I'm feeling some warm and fuzzy kind of stuff for this person. That's more about the romantic partnership coupling piece that has zero to do with what their gender is, right? So that's around dating, romance, who you want to partner with romantically and sexually. Gender identity has nothing to do with any of that. It is a brain piece that says that the biological identity that I was born with and how the world puts gender roles on me does not match up with what's happening in my body, in my brain, and out in society. Whether that means that someone biologically born female completely identifies as male and masculine with male pronouns, or biologically male and completely identifies as female. And then there's some pieces in between. So we talk about gender nowadays, and has been talking about that for quite some time, that it's non-binary. And what that means is there isn't just male and female, right? Which really rocks a lot of people's worlds, because that just doesn't make sense. So what that means about non-binary is that people can be gender neutral. People can identify with a little masculine and a little feminine, but it isn't just one or the other. That there really is a blend, that there really is a neutrality. Some people might say that's gender queer. But again, that has nothing to do with who they're romantically attracted to. Mm-hmm. This is just about how they identify in terms of their gender. And there isn't just one or the other. And this is, again, something that our culture now is really looking at and really exploring, but has been around for quite some time. This is not new. It just feels more new. You know, and in terms of substance use, substance abuse, let's say with transgender, trans people, for example, you know, depending on their family, depending on origin, depending on where they grew up, cultural beliefs, religious, spiritual beliefs, there can be a tremendous amount of shame, of embarrassment, of guilt, of messages that says something's wrong with me, I'm broken, I'm bad, this is not okay, I'm going to be alone. There's just a million messages that can come up for people, which again creates definitely some feelings, some mental health, some struggle. Almost every trans person I've ever worked with has had some type of history or presents with depressive symptoms or clinically major depression, a mood disorder of some part, some anxiety, some challenges, potentially something traumatic as a result of coming out as being trans. So insert drugs and alcohol at some point for a lot of these folks. The suicidality rate for this population exceeds the national average tremendously. I don't have the numbers out in front of me, so I don't want to throw a number out there, but exceeds the numbers. I do know over 54% of adolescents in middle school and high school that identify as trans in some capacity have had a history of serious suicidal ideations. So every other kid essentially has had serious thoughts of suicide. Again, the attempt rate is also very high for adolescents as well as adults. So again, insert substance use. For some of those people, do they become addicted and that's a coping mechanism from now on? Absolutely. For some, they just find that there's a use for it, but don't necessarily get addicted. So here we've got this complex beautiful human being that is going through so much pain and shame and confusion, and maybe or maybe not doesn't have the support of a family or friendships, and is trying to cope the best they can. So we've also got a population that has a high non-suicidal self-injurious rate or self-harm behavior. And again, we've got these substances that what we know about addiction is it's definitely keeps us isolated at times. So we've got someone who identifies as trans, where that's already very isolating, and we throw substances into the mix. So wow, you really want to look at an isolated individual that's really struggling and now they're addicted to something. That's a pretty tall order. So it's not unlikely to have someone who's trans, whether they're active in it now or have a history of substance use and dependency. It has been a very powerful coping tool for them, just like cisgender people, right? So the need for treatment for transgender people is very real, very significant, very much needed, which is why I love Recovery Ways, because y'all can support having a transgender client. Want to be compassionate, want to have a lot of education about that. That's the key. We don't have to know everything, and we let our clients teach us about them, right? Regardless. But the need is deeply, deeply there. The need is deeply there for transgender folks who are actually in a desperate need of recovery and a desperate need of connection. We all need connection. We're hardwired for connection. So that was a big old long answer.
I loved it.
I get excited about all of it. I get passionate about all of that.
We talked about the guilt and shame that a transgender person can experience because of society's beliefs, society's systems. What needs to happen differently within the treatment community, the mental health community, the behavioral health community, to be able to better support a trans person?
We need like a week to talk about that. It's an awesome question. And, and hearing you say that, and I know you're referencing words I've used, I also want to say there are a lot of trans people that don't have guilt and shame around it, that they're really clear about who they are. And for a lot of them have more frustration, annoyance, anger, because they are really clear about who they are and other people can't seem to get on board. So I do want to say that some people aren't ashamed about it. It's just the lack of community, the lack of connection and support about who they are. So kind of going into that is, I think what a big piece of what this population needs from mental health professionals, treatment facilities, is for us to basically know and connect with them. There's nothing wrong with them, truly. Now, maybe they're coming into your treatment facility because they've got substance use disorder, they've got some depressive symptoms, they've got some maybe some personality stuff, maybe they've got some mood stuff going on, just like other people that walk in the door. But theirs is a little more complex because of how they identify in the world. The world has really engaged with them differently in a really unfortunate way. And so one of the biggest pieces I would want to say to practitioners in the healthcare industry is these people are not broken. There's nothing wrong with them around their gender identity. Let them teach you who they are. That's the other piece I would say. Let them tell you their story. And we do that all the time with people anyway, right? We sit with people in their story. The other piece I think is so important in what I say to clients, for me, and I've worked in all levels of care, residential, intensive outpatient, PHP, sober living, clinical director of a sober living program, so all these other pieces. And so what I sit with clients and what I want to be able to say, regardless of their gender identity, is I am here to wade in the deep with you. I can be in this with you. And again, I think education is so important. Education, training, connections to what's happening around standards of care for transgender health, to be connected to WPATH, to be connected to USPATH, to learn about medications. We're so quick to learn about a lot of medications that can help with different things, but it's so important to learn about medications and how that might interact with hormones. I also think with education, it's important to have an assessment, some assessment education of when you sit with someone and maybe they're quick to tell you, hey, I think I might be trans. Is there a mental health professional that can sit and assess to see, Are they trans? Or maybe they've got some hidden things around their cross-dressing, right? So cross-dressers aren't necessarily trans. A lot of cross-dressers are not transgender. So to really be able to assess for that. So that's another important piece. So I would say education is paramount. And when I mean education and training, it doesn't mean that just because maybe you've met someone who's trans, right? Or maybe you know someone, right? Or maybe you've been to, a transgender parade, march at a pride festival, which is amazing, by the way. I support that completely. That does not mean that you have the skill set and some training. And again, we don't know what we don't know, and that's okay. So that's really what I would want to say is get some reading, get some education, watch some documentaries, spend time with people. And again, let them tell you their story. Don't assume. And again, we do that with people all the time. We want to sit with them and know their story. So that would be my biggest pieces. Continuing to go to trainings, continuing to ask about what you can read, getting some supervision and consultation. I do that for folks too, is providing consultation for people who say, hey, I had a client walk in my office and after the third session say, this is what's going on. And they say, I don't know what to do with this, but I'd like to know what to do with this. I'd like to know how to support them. Good for you. Awesome. Let's find someone you can consult with. Don't claim to know that you'll know what to do. So I think those are my biggest pieces is to raise your hand and say, I don't know enough, to keep learning. I think that's what we all need to do in this healthcare industry anyway. And then the biggest piece is there's nothing wrong with them. They're not broken. They don't have missing parts, but especially if they're coming to treatment for substance use, like all the clients walking in the door, they're using substances for a pretty good reason, and we want to figure out what that is and give them new coping mechanisms.
Do you think it's possible that a transgender person could go into a treatment facility or even sit down with a therapist or even a medical hospital and be traumatized by a staff member that is improperly trained?
Absolutely. That's a beautiful leading question, right? Because you already knew the answer to that. I could feel it. But I love that you're asking because that absolutely happens often. And there are ways to safeguard that. There are ways to protect that. Again, that goes back to some education and training. For example, even just paperwork, walking in the door. On some of my paperwork, as a client fills out new client paperwork, I have listed what's your legal name, what's your full legal name, and then I have under that preferred name. What do you want me to call you, right? I would do that for everybody. My legal name is Christina. The only person that calls me Christina is my mama. The rest of the world, when they say, hey, I'll say I go by Christy, right? That's what I prefer you to call me. So just by having something like that is really important. Also on my paperwork, I have the word gender written with a line. I don't just have circle M or F, male or female. That doesn't fit for everyone. So again, it's about being inclusive. It's about saying, I can include you. I'm going to find my way on how to do that. And then based on the paperwork is then to ask, what pronouns would you like for me to use? And I use that language versus what pronouns would you prefer, right? That sounds different. So you identify as what's called a cisgender male, right? And cisgender means that you're biologically male, you identify as male, and your gender expression, which is how you dress and how you present to the world, is male, right? So that means you're a cisgender male, right? So if I looked at you as we're talking and I would say, hi, Bob, what pronoun do you prefer? And you'd kind of look at me and be like, duh, male, like he, him. And you would probably think, maybe in your subconscious, I don't prefer that. That's just who I am. Does that make sense?
Absolutely.
So for me, that's another piece about healthcare, is to be really conscientious of our language and our choice of words and how we word things. So for me, I do my best. It's not perfect, but I do my best to say, what pronouns would you like for me to use? Versus saying, what do you prefer? Because you don't prefer it, it's who you are, right? I prefer for people to call me Christy over Christina. I don't really prefer she and her. It's just who I am. It's not a preference, it's who I am, right? So the language again is, what pronouns would you like for me to use? Again, that empowers them and says, gosh, this person really hears me and sees me, and she's asking me because she really wants to know. And then they get to say whatever they choose, or what fits for them, what's right for them. So right off the bat, they're feeling seen and heard and connected to. That's the biggest piece. The other piece is just letting them know that I'm trying this out. This is a new experience for me. I'm so glad to meet you. And guess what? We don't do it perfectly. None of us do empathy perfectly. None of us do connection perfectly. But to be able to claim that and just name that. So yes, a lot of healthcare. And again, about dress and clothing, don't assume. You know, there's all kinds of jokes about what happens when we assume things. So again, get curious, but I say be compassionately curious. Language is everything. Language is everything. And your energy is everything. If you don't know something, compassionately ask.
Yeah, I've heard horror stories of people going into medical facilities, treatment facilities. For example, a trans female, right, born with biological male parts, going through a urine-based drug test and being forced to have a male accompany them into the restroom to be monitored while they took that urine-based drug screen instead of a female, which is what they would have preferred.
Sure.
And I can just imagine just the sort of emotion and feelings that would bring up.
Absolutely, and I think there are absolutely emotions and hurts and confusions that can come up, and I think from treatment facility standpoints and things like that, I think sometimes their brain can go to malpractice, liability, safeguarding things. And so I think even some of the best and most sound treatment facilities, can struggle with boundaries, can struggle with pieces like that. Absolutely. But again, I think it's important to safeguard what's in the best interest of the client, to prevent even further isolation, to prevent even further shame, guilt, treating them differently, reinforcing how the rest of the world sometimes can engage with them, is what it means to be inclusive and to use inclusive language. Yeah.
So taking the two back together, substance abuse and gender identity, what are some downfalls you see in the industry?
I think lack of education and training is a shortcoming. I think there are people that this is something that's really being brought out into the mainstream a little more so than ever, even though it's been there for a really long time. So I think sometimes when people don't know enough, then they can get scared, get uncertain, get really uncomfortable, and say, we're just not going to deal with that. And then essentially close their doors on that population. So again, I think training and education lack of that can be a downfall. I think also assuming that they think they know what might be best can get people in trouble. So one of the pieces I hear often is we're going to put this transgender client on a totally separate wing of our facility, or we're going to make this storage closet, we're going to make this into a bedroom so they have their own bedroom so that they're not making other people uncomfortable, right? So again, while I know that can be scary and treatment facilities can worry about impacting the milieu of the community, and I can appreciate and understand that, it really is about inclusion, and it's about, I really believe that the staff is that trickle-down effect. So if staff are struggling, uncomfortable, challenged, upset about a transgender client, guess how that spills over, right, and impacts the client milieu. So again, it goes back to that training and education. Again, I think it's important to check things out with the client, check things out about what they need, what feels comfortable. And I think there are times, if we flip to sexual orientation for a minute, we've certainly had that stigma and had the history for a while of people saying two women or two men, and let's say if one of them is gay, somebody else says, well, I don't want to share a room with a gay person, right? And so we've slowly started to watch that shift a little bit more, slowly, but it's shifting. And again, if staff can get on board and how to support and attune and connect to that, that's the ticket, that's the key. So I know there are facilities that'll say, oh, if we bring a transgender person here, people are they're gonna pull their kids out of treatment. They're gonna pull their loved ones out of treatment. Again, it's fear-based. And so again, if we can get staff in that treatment facility to get some training, to get some education on how to best support someone trans, whether it's with bathrooms, right? Whether it's with grooming, whether it's with clothing being changed. Well, guess what? We do that for the privacy and sanctity of everybody. We do that for everybody. But to have open dialogue around it. The same is true in a facility if two roommates are having issues together. No matter what their gender identity is, typically a staff person steps in, wants to sit down, wants to mediate, wants to say, what's going on, guys? What's going on, gals? You know, what's coming up? Let's walk through this together. To me, it's no different. Yes, there's an added element that maybe is new, but it's no different. And it starts with the staff. The staff impact the client culture in that regard. And that's really important. And again, I think the language is important. Again, it needs to be all about inclusion. We do that anyway. We do that around sexual orientation. We do that around religion or spirituality, right? Race, culture, ethnicity. Again, we want to be inclusive, right? There are treatment facilities out there that are just Buddhist based or just Christian based, right? And then there are other treatment facilities that say, whatever your spiritual background or religious background, if that's important for you to incorporate it in your own way, then we want to support that. Again, that's that inclusive language. So we just need to have more training and education on how to spill that over, right, in other capacities. We look at Title IX, right? People are supported around that civil rights piece. Again, I think a lot of treatment facilities around substance use and gender identity are doing what they think is best, and I really can appreciate that, but sometimes the choices that they're making are harmful, and they just don't know. They just don't know. So yeah, just having people raise their hand and say, I need to know more.
So let me ask you this. We've talked a lot about the need to educate and be properly trained. If a facility is not educated on gender identity, do you think it's better that they just don't accept transgender patients and refer them out, or go ahead and accept them?
There are a lot of treatment facilities that don't have the training and education, are maybe open to that. So one of the pieces I would say is, if it's a treatment facility that is really able to connect to their foundational kind of piece around who they are, if they know full well that they're not going to work with their staff on starting to get trained and educated, they just don't feel comfortable taking trans and they're not sure that they want to really get more training, then by all means, please refer them somewhere else. The other piece I think that can happen, and certainly does happen, is someone who admits, right, into treatment, let's say as Stephen, or is biological male, talks about being Stephen, and even while he's there, begins to have some sobriety, begins to feel more comfortable, more connected, and then really starts to share, this is something that keeps me using, and I need to identify that. So again, I would want a treatment facility to meet as a staff and to say, are we willing to make some phone calls? Are we willing to do some consultations so that we can help support this client get exactly what he needs while he's here? While at the same time letting this client know, being really transparent. We encourage our clients to do that. I think in some regards we owe that to them. So there will be times where a client comes in and maybe the staff's like, well, heck, this is new for us. So you are doing that client such a service, an act of compassion if you actually say, this is new for us, and we want to make this the best experience for you possible, and we're going to need you to help us with that. So we're going to be walking along this with you, but in the meantime, we're going to be consulting and we're going to be doing a little bit of our own work because we want this to be what you need. And we want to support you advocating if you're getting that or if you're not. And the reality is we do that with clients anyway. We want all of our clients to do that, all of them. So that's what I would say too. And then maybe after that client hopefully successfully completes treatment, then that is the time for staff to come together. Not just clinical team, but all direct care staff to come together and to say, gosh, that was a new experience for us. How can we talk about that? And how do we want to prepare ourselves as a treatment team to be ready for the next time? Because there will be a next time, especially if someone's presenting up front. Again, it's about communication. If a team can communicate, that's key.
So I'm guessing I already know your answer to this, but if someone identifies by a certain gender, let's say male, should that person be placed on a male wing or in a male facility, or because they're biologically born female, what do you think the appropriate thing is to do in those cases?
That's a great and complex question.
Yeah.
And what I would really, it feels like complex, and then in some ways it can say, yeah, if they identify as male, put them with a bunch of guys. But again, get to know your client. How long have they been identifying as male? Mm-hmm. Did they just decide, maybe they've been identifying as female, and maybe on the plane ride, they're like, man, I'm going to a place where nobody knows me. I can maybe try this out for the first time. Again, you want to find out how they've been identifying, how they've been connecting, if this is new for them, and you want to support them in how they identify. So if this is someone who says, I've been out as trans for a year, for 2 years, for 6 months, for 10 years, and this is how they identify, that's who they are, regardless of what's underneath their clothing. So in my opinion, I want to get to know the client uniqueness, and I want to know their story. But if they identify as male, yeah, I want to be that staff person that can help support them in that. I want to educate and support the staff on that. And if this client gets to a place where they want to identify this with other clients, guess what? Guess whose support they're going to need first before they can talk to those clients? Their peers. Guess who they're going to need that says, I've got your back? It's the staff. It's the staff, right? Saying, I've got this. I can hold this space for you. I support this, and I can support you sharing this with group today, if you choose. And that's the other piece I would go back to, with staff, is that it's not anybody on staff's job to out them to other patients or other clients. That they will share that when they're ready. Just like a medical condition, just like sexual orientation, just like their race, religion. It's not your job to do that. Now within a staff and with a treatment team, that's different. You're talking about the care and well-being and welfare of a client. Again, I always want to assess and get to know that client and kind of where they are.
So it reminds me of what you said earlier is, there's nothing wrong. There's nobody different because we do the same exact thing with every other person that walks in our doors. And just because this person is transgender doesn't make them in a way unique or different. Just like if a Catholic or Jewish or Christian or Muslim patient walks in. You talked a lot about education, and I'll bring that up again because I do believe it's key. Where can a therapist or any sort of mental health professional get educated on these things?
Mm-hmm. For my own 2-second plug, I'm doing more of those starting in 2017 on, how to clinically and effectively work with transgender adolescents and adults, but also doing some work on how to work with their families. And then also how to help someone in the workplace, kind of coming out in the workplace, in school systems, how to work with siblings. I think siblings get left out a lot. We talk about parents a lot. We talk about school. We talk about work. What about siblings? So for me, for certain, I'll be doing some trainings. There's also some great supportive, you get online and just Google different trans communities. And if you go to WPATH, and so I'm a member of WPATH, and that's something that I believe is really important. I think that's a great built-in way to help treatment facilities, private practice clinicians, psychiatrists, all different types of healthcare to read up on the ethics and standards of care and practice for people in the transgender community. What WPATH stands for is World Professional Association of Transgender Health. That's paramount to me. That's important. You can get journals. There are journals about the Journal of Transgender Health. So reading journal articles, reading the latest research. Please don't let social media be your only navigation system for the latest clip or the latest commercial. Well, I think social media can be really powerful. I also think it can be really harming. So again, look into the journals, peer-reviewed journal research articles. I think those are really important. And again, if we look a little bit more at the West Coast, there's more information where some people out west have been doing this work a little bit longer. It hasn't been as taboo. But even internationally, there's some doctors in Serbia that do different bottom surgeries for folks. So really just to get versed. The WPATH is a great place to look up other people in every state and city. If you were to put in there Roswell, Georgia, my name's going to come up as a provider, but not just a provider, but someone who adheres to the transgender health standards of care and ethics. That's important. So that's another great place to look. There's also conferences. There's one out west, it's called Gender Odyssey, that works with adolescents and families and adults. That's been a great conference that's been around for years. So again, just looking up information, reaching out, asking questions, I think is really important.
I'm going to switch over to your other specialty. I think I called it severe trauma, but then you said complex trauma.
All trauma is severe.
Absolutely.
To me.
It is. What is your definition of trauma?
Yeah, there are a lot of definitions out there of trauma. So I would say just a brief definition is some type of event, whether you've been an active in that or witnessed something that has dramatically impacted your life and impacted the way that you are moving through the world, and how that impacts your daily functioning, how that impacts your mood, how that impacts your body, social relationships. And again, if it's keeping you from doing certain things in your life, or if you're doing more of something, again, it's about what's disruptive to your system. And something that could be traumatic for you might not have been traumatic for me. So does that mean that it shouldn't have been traumatic for you? No, because it's in how you interpreted that experience, how your body interpreted that experience, and how that continues to impact you. So when I say complex trauma versus trauma, so trauma might be, let's say if my story is that I was raped at age 15, okay, which is awful. I think all trauma is severe. And let's say, I'm now 33, and while that's been awful and it's certainly impacted me in ways, I haven't really had anything else traumatic that I would identify happen. So that would be traumatic. Complex trauma is where, let's say I was raped at 15, but I was also sexually assaulted when I was 8. Let's say I've had 2 miscarriages, I had a house fire, and I was in a really bad car accident. So most of those are not the same, and they're all really different, right? But those are traumatic events that have compounded and built on top of each other. And my sweet little nervous system has just had a really hard time sorting things out. And I have a lot of trauma that's impacted me on a cellular level, and is impacting how I move through the world, my fear-based beliefs, thoughts that I have, and kind of getting stuck in this loop of I don't know how to get out of it, and my body has all these memories. So that's how I would identify the difference between when I say trauma and complex trauma. And most of the folks I work with have complex trauma history.
Mm-hmm. So you said something earlier about what's traumatic to one person might not be traumatic for another. When we think trauma, thinks things like molestation, rape, combat.
Yes. And those are trauma. Those are traumatic.
What else is there? Can anything be trauma?
Depending, certainly, because it is about that person's experience. So other things that I, again, would consider traumatic, or certainly people have identified as trauma, is neglect. Being neglected, emotional neglect. I've worked with people who have been deprived of food and water for days. Is that traumatic? You betcha. right? To not be given basic needs, to have basic needs withheld from you, that's traumatic. For people to be in a natural disaster, so again, a tornado, a hurricane, a tsunami, floods, for people to lose everything they've had, or for people to just experience the chaos and the sheer terror and deep fear that gets ingrained in our bodies around a natural disaster. Certainly people who have lost a loved one suddenly, maybe and unexpectedly, that can feel traumatic. I gave the example of having multiple miscarriages. That can be traumatic. Medical complications. So someone going into, let's say, a hospital visit or a surgery, and things don't go well, and there's complications, and there's a lot of different other facets. That can be traumatic. I've worked with someone who has had a traumatic dental experience of being at the dentist and has a history of being a kid and having teeth pulled and having one of their parents and their dentist literally strap them down and hold them down as they're kicking and upset while they're trying to pull teeth. Guess what? Now this person as an adult hasn't been to the dentist in almost 15 years. Guess why? So again, there's multiple things. Witnessing violence, right? Even if you're maybe not a part of the violence, whether you are acting on the violence or whether you're being a victim of that, just witnessing someone experiencing violence, especially if it's a loved one, that amps that up. But even two strangers, the damage and the impact to the psyche that can do to someone. And psyche meaning the breakdown of soul. That's actually the Latin word for soul, is psyche. So again, I think that we could keep continuing lists. For some people, a divorce can feel really traumatic based on the experience. And losing a child can be traumatic. So again, it's important for us to learn and know what's impacted you on a deep level.
So if I remember correctly, you're a little bit of a brain nut, and you love the way the brain works and how the rest reacts to it. And I guess the next question would be, in a younger person, an adolescent, where the brain might not be fully developed, or even in a young adult, how can trauma impact that brain differently than it could in adults?
Yeah, and again, that's one of those questions where we could talk about it for weeks and weeks. It's a great question. It's a very complex question, which is, when trauma impacts a child, we're also, what it means is we're impacting their nervous system, we're impacting their body, and we're deeply impacting a very new developing brain. And what we know about the brain is that it's not fully formed until between the ages of 24 and 26 years old. So there's still a lot of growth, a lot of development. And what we also know about the brain is we've got language centers of the brain, we've got rational, logical thinking parts of the brain. So depending on when a traumatic event happens for a child, so to speak, a lot of times kids don't know how to tell you what's happened with a traumatic event, aren't able to put together some linear sequencing, aren't able to rationally and logically think through the event, so they make up all kind of things about it. And adults can do that too, but for kids, one of the last parts of the brain, or one of the latter parts of the brain to develop, is the part that is in control of rational, logical, critical thinking, right? So for a lot of little kids, when you tell them, okay, let's think this through with the decision they're making, they either don't want to do it at all, or they want to do it right now, or it's now or never, or there's no in between, and they're not quite sure of how to think things through. For one, maybe they haven't been taught, but two, that part of their brain is still forming, as well as their language centers. So when kids can't tell us what's going on or can't share things, that really gets embedded in that implicit memory in their brain, and that gets locked in on a really deep level. What we also know about trauma and the hippocampus, which is so much in control of our emoting and moving through the world and capacity for different cognitive functions. What we know about that part of the brain is if a child has experienced multiple traumatic events, is that part of the brain gets smaller. It's actually smaller. Does not get to a size where, let's say, a child who has not experienced trauma has. So the good news, which is newer research shows that the part of that brain can heal and actually get to a different size if healing is provided, if that deeper work is provided. So we do know that trauma directly impacts size and structure of the brain, of healthy brains, and of kids that have not experienced trauma. It also happens when kids experience neglect, whether I was talking about basic needs of food and water, but how that can also be experienced if a kid is not provided touch, emotional touch, affection, attunement. That if a child were to fall down and scrape their knee or have a really not good day at school, and they come home and they know that they're not going to get the affection and attunement from either of their parents, and then they have to somehow figure out how to take care of themselves, that's a very disruptive part to their nervous system and their attachment adaptation. Is they learn, right, I'm not going to be able to get my needs met, so I'm going to have to figure out how to do it myself over and over and over. And what does that look like in adulthood? It means that these are our adults that absolutely pride themselves on not asking for help from other people. These are the people that say, I don't need anything from anybody. Where did that come from? They learned when they were little, I'm not ever going to get my needs met because I didn't have caregivers who knew how to show up for me in the way that I needed. So can that absolutely compound some traumatic events for them? Absolutely. Kids not getting their needs met. So it does impact a developing brain. And again, depending on if kids don't get their basic needs met, if they live in a traumatic or violent home, guess what? These kids probably aren't getting very good sleep. Hardly ever. They're scared all the time. There's a lot of noise all the time, right? They're uncertain of if they'll have to wake up in the middle of the night and go somewhere. I think nutrition and food is also really important to those developing brains, right? Especially if they're in a traumatic environment. Their nervous system doesn't know how to relax, to slow down, to calm down. So these are the kids at school that either might be really quiet, might not engage with others. These are the kids that maybe are perfectionists, that are all in at school and just get all those spongy good stuff at school. Or these are the kids that are throwing toy cars and hitting a little girl in the head, or the kids that are running around and screaming, or the kids that are knocking over stuff. They get labeled the bad kid, when in fact they're not the bad kid. They're so emotionally overwhelmed that they don't know what to do with all their feelings. Because again, that language part of the brain is still working to develop. But the brain it absolutely gets impacted as a kid. Certainly as an adult, our brains are absolutely impacted as adults too. But again, we want to safeguard and protect these little precious beings as best we can. There is no such thing as perfect parenting. We're just looking for some good enough parenting, right? and there are some kids that are missing that too, or that things that get violated that happen that are outside of a parent. So yeah, brains are really important, and those basic needs are really important to help protect their brains in that way.
Relating it back to substance abuse, what happens if someone goes into a treatment facility but the underlying traumas are not dealt with?
Great question. And that happens all the time. Because the reality is if someone goes into treatment and they're going in, let's say, for 45 days, they're not going to get all this deep, intensive trauma work, which is par for the course, because maybe they're getting there and maybe they got 4 or 5 days of detox, and maybe they're trying to get settled, and maybe they're starting to feel their way in their own skin. What I think is important is to have a staff in a treatment facility that can be trauma informed. Doesn't mean they need to be trauma specialists, right, or trauma therapists, but to be trauma informed, to be able to support this person in the capacity of maybe just naming a trauma, not specifics, don't need details, don't need specifics, right? If someone doesn't know how to support that, we're not looking to re-traumatize. We're not looking to pull up a bunch of details and then somebody say, okay, great, thanks for sharing. Have a great day. They don't know what to do with that. Their coping mechanism has been drugs and alcohol for years. So again, it's about how can someone support that person if they get to a place where they just want to name and say, hey, my uncle was really inappropriate with me for about 2 years of my life. Man, maybe they've never been in a safe and secure enough place to even be able to name that. So maybe that is the beginnings of that trauma work. And to me, a big piece of laying the groundwork for trauma work, even if they don't do deep trauma work in that treatment facility per se, is you're laying the groundwork for that. You're creating a safe, supportive, caring, and attuned environment that says, I see you, I care about you, and I want to help give you some great coping mechanisms. I want to learn about your old ones, and I want us to come up with some coping mechanisms. What happens when you get poked with different stuff? Let's look at some of the mental health pieces. Let's talk about the reactions that you have in your body that get you paralyzed, that bring up cravings. Let's look at that. All of that is laying a pretty incredible foundation for trauma work, because what we do know about doing trauma work is people can only do trauma work if they feel safe, if they're in a space where they have some trust, and if it's calm and quiet. Loud, disruptive, chaotic, a lot going on, yeah, they can't drop into that. So again, it depends on the program, but again, a traditional, I say 45 days because I think 30 days is just too stinking short for anybody. I'd love to see people, for us to be able to support financially people being in treatment longer, depending on their history and their story. But again, I think if people can just provide that safe, supportive, containing environment to say, I hear you and I really want to honor what you're sharing, and not open them wide open and then not know what to do with it. That's important to me. Mm-hmm. That's important around someone coming in. Yes, you're going to have people coming in with unresolved trauma. Absolutely. But for them to have the experience of going somewhere first that says, and having their whole system feel a safety and connection and look, I can do this, then that's laying the groundwork for their next step, for maybe when they do leave or when they go to that next level of care. They're that much more ready. Their brains are starting to clear, right? In a short 45 days, starting to clear. And they're getting back to eating and sleeping and connecting with other people and really starting to look at their stuff, right? That's that purpose. And again, having staff that's trauma informed, not necessarily specialists, but having some awareness of how to support someone who has trauma without opening them wide up.
How can people find out more about you and what you do here and all the great things you do here?
I think my website's probably the best way. Certainly people can call or email, but if people just go to my website, Christy Plaice, so Christy, Plaice, PLAICE.com. It's got kind of my areas of specialty, where I am, what I do, when I offer retreats, trainings, workshops, consultations, doing consult work. All of that information's on there, and contact availability is on there.
You do retreats?
I do.
Why did I not know about this?
I don't know.
Thank you, Christy.
You're welcome, Bob.